what advocacy comes down to truly is storytelling. We pair the data, obviously. That's what these organizations like ours and other organizations, nationally recognized local community organizations, they have the data. You have the story because it's your life and you know it best. So the most impactful advocacy goes beyond those data points or the policy briefs. And it's really about real people. It's about your experiences, your challenges, and hopes that can bring an issue to life. They create connection, and that's what moves decision makers to act. So we talked a little bit about how members of Congress are people too, agency officials are people too, and they do, no matter how we approach it, there is a level of our personal experience that influences our lives and understanding of things. And so we want to make sure that we're sharing those experiences. So the toolkit that we have includes tips on how you can strengthen your message, asking questions about like what's your why behind your advocacy, who might be affected, what change would make a tangible difference to the issue that you care about. And that can really translate an idea into a very compelling call to action. So I want to pull Lauren back up here. She's an accomplished author, motivational speaker, and strategic content and branding expert. And you are really like the person on how do you share your story, the power of storytelling. And I would love for you to share how that's shaped your own advocacy and what your advice is for people who maybe want to start doing this. And that can be, to your point, anything related to as patients, to providers or with providers, as caregivers. How does that storytelling inform their advocacy and interactions?
So, so for me, thank you so much, Kitty. So for me, my storytelling about my own lived experiences started when I was working in women's magazines. And there was an editor in chief. Her name was Joanna Coles. Many of you may know her today. Actually, now she runs the Daily Beast. And she just said, your story about who you are is so powerful and your voice is so powerful, but yet you don't speak about it. But yet everything you do and who you represent could be so powerful to the disability community. And so I said, well, what are you talking about? And she just said, well, you don't even understand what you dispel to the world. And so I really thought about that. And as I thought about that, I wrote my first article, and it was really, it became the most read article for Marie Claire magazine of the year. And what I did was I just thought about the questions that I asked myself and how I think that people perceive me and what I want out of other people, and what I started asking other people and what they thought about me. And I think that when you're physically disabled, the world thinks about you very differently, and how you perceive the world and how they perceive you. And that's kind of how I started storytelling. And what what really made me think about and how I have brought so much into storytelling, and my storytelling has become so much of advocacy. And when I'm on the Hill or telling a story, I truly, truly think about what is the end game and what is the advice that I can give to people, right? And so while I'm telling the story, is what is the give back to the person reading the story? So I think it's similar to when you're on the Hill, when an advocate is on the Hill, or when an organization is on the Hill, is what do you want the that particular organization to give back to you, or for what you want them to learn from you. And that's kind of what my storytelling has done. And for me, when I'm telling the story, I want that person to almost live that lived experience with me at that moment in time. And so to like kind of like wrap it up in a bow, my my message to everybody is, here's what I have done, and here's how you can do it in very simple ways as well. And so everything to me is like, here's the 5 ways, right? So because I come from women's magazines before I got into healthcare, it's like, here's the top 10 ways you could do this. Here's my guide too, kind of like you all have your toolkits, right? I chop things into here are the 5 ways, here are the questions that I've asked. Here's how now you can take my own lived experiences, put it into your own script, because that's what I want people to do is take my own experience. Now take that script that I have created for myself, think about your own scenario, and then put in your own words in it. And I think that that's how we can take your own life experience and then take that and then help somebody else and help somebody else. It's kind of like they say, oh, just take that script, different person, new script, different person, new script, different person. And that's how I believe. And plus, like, the story becomes almost, has like that viral feel. And then when I go into any congressional office, I want that person that's I'm telling that story to feel what I feel as well. Because if I can make them feel what I have gone through, that changes their perception. And that's ultimately what storytelling is, right? I want them to really feel and understand. And that's what will help change policy, I think, right?
Yeah, I
Is that,
think the connection piece, that relationship piece is really critical. And it's something that, you don't know somebody else's perspective until you've heard it and you've had a chance to really consider. And actually, to that point, earlier and offline, we were talking a little bit about this, but I feel like that translates into some of the other work that you're doing. I want you to talk a little bit about how you have gone into medical schools or helped clinicians understand how to interact and engage with patients in a meaningful way.
yeah. And so I think that, I've gone into medical medical schools, I've gone into hospitals to really help doctors and nurses treat us as humans and not just as pincushions. Because a lot of times when you walk in with, for example, for me, I have a rare disease, McCune-Albright syndromes, that they will call a board disease because they have to know it for their medical boards, but then they will never see it again. So when they find out and identify that I have this rare disease, I automatically become like a scientific experiment where they don't look at me as Lauren, they look at me as patient X, right? And so what I do is say, hi, I'm Lauren. I have McCune-Albright syndrome. I need to help you understand about the disease. And I have a million questions for you, but I also need you to understand the disease from my perspective as well. And so I kind of teach them how to be human as well and not just doctors and scientists at that moment in time. And I think that that human interaction is so important between patient and doctor, and not just, oh, I found a new discovery today. And so many times that happens, and or what happens is, I can't help you out, I don't know what to do with you, instead of, I don't really know because I had to know it for my boards, but I've never really seen. So, but let me help you get to the point that I know I can help you. Right. So it's like to humanize it. And I think that's what storytelling does. It humanizes whatever you're going through. Right. Or it helps humanize the story. It helps humanize whatever somebody is going through. And that's what life experience is. Right. And if I can humanize what I'm going through to help somebody else or to help a doctor treat another patient, that's really what my end goal is all the time.